Healthcare makes up 17% of the entire U.S. economy, and there's an estimate that 1/3 of what we spend is wasted. $700 billion thrown away on unnecessary tests and procedures. Today, some of the most respected medical groups in America, representing 375,000 doctors, said it has to stop. But what they recommend would change health care for everyone. We asked our Dr. Jon LaPook to tell us more.
The 45 common tests, procedures, and treatments were considered often unnecessary. They include routine electrocardiograms during a physical, MRIs for back pain, CAT scans to find out the cause of fainting, and certain imaging tests for patients with early-stage breast and prostate cancer. The goal is to decrease the overuse and misuse of healthcare. Government studies have found that 30% of the $2.5 trillion annual healthcare tab is not needed. Dr. Michael Barry is an internist and president of a foundation that tries to improve outcomes in healthcare.
I think both physicians and patients sometimes get into the mindset of thinking more is always better. But it's really important to think through each thing we do, not only from the perspective of cost, but from the perspective of making sure we're not doing harm to patients.
Sometimes the tests produce false positives, abnormal results that turn out to be harmless, but they lead to more tests and procedures that could have side effects. Previous efforts to limit testing have provoked public backlashes.
Stay just like that.
In 2009, new mammography guidelines that recommended less screening made patients fearful that doctors would miss opportunities for early diagnosis.
Many of the doctors who called for these recommendations said one reason they ask for these tests is fear of being sued for malpractice if an illness is missed.
Now, Jon, you see patients every day. What's the practical effect of this on a doctor and his patient in that relationship?
You know, Scott, it's tough because we're emotional creatures just like everybody else. So I know the recommendations, I know the facts and statistics for the country, but I'm looking across at that precious, precious patient. I'm thinking, I don't want to miss anything. And perhaps, at least in my case, I remember a patient whose life was saved by an unnecessary chest x-ray that happened to pick up an early lung cancer. That said, these recommendations are good, they're absolutely useful, they're needed, but there is this emotional tug that goes on. We're people like everybody else.
Jon, thank you very much.